Let me start with something most men have never heard before. Doctors and vascular specialists sometimes refer to the muscles in your calves as your body's second heart. Yes, a second heart. Not in your chest, but in your legs. And the reason I'm telling you this is because today's video is about why doctors say this simple chair exercise acts like a second heart. And if you're a man over 50, understanding this one idea could completely change how you think about circulation, energy, leg health, and even aspects of sexual health. Because there's a simple exercise, one you can do using nothing more than a chair, that activates this second heart and helps push blood through the lower half of your body. It takes just a couple of minutes. No gym, no equipment, no complicated routine, just a chair and a small movement that your body was designed to do. But before I show you that movement, we need to talk about something that affects almost every man over 50. And that's the topic of why circulation problems start after 50. Why circulation problems start after 50. So let's talk about it plainly. As men get older, circulation naturally becomes less efficient. Not overnight, not suddenly, but gradually. Muscle mass slowly declines. Blood vessels lose some of their elasticity. Daily movement decreases. And many men spend long periods sitting, at desks, in cars, or on the couch. Over time, all of these factors contribute to a hidden problem. Blood begins to move more slowly through the lower body. And when circulation slows in the legs, a surprising number of symptoms begin to appear. You might notice your feet feel colder than they used to. Your ankles might swell slightly at the end of the day. Your legs might feel heavy or tired after sitting too long. Night cramps may start appearing. And sometimes men begin noticing changes in energy levels, stamina, and sexual performance that they never connect to circulation. But there's one specific part of the body that plays a huge role in this process. And this brings us to the next idea. Your calves, the body's so-called second heart. Yes, doctors consider your calves to be the body's second heart. Inside your lower legs are two major muscles, the gastrocnemius and the soleus. Together, these muscles form what many doctors call the calf muscle pump. Here's how it works. Blood traveling through your body eventually reaches the legs. But the veins in the legs have a difficult job. They must push blood upward against gravity back toward the heart. And they don't do it alone. Every time your calf muscles contract, they squeeze the veins inside the muscle. This squeezing action pushes blood upward. Then small one-way valves in the veins prevent the blood from falling back down. In other words, every step you take helps pump blood upward through your body. That's why many physiologists refer to the calves as a second heart. But here's the problem. When men become less active, that pump stops working efficiently. The calves stop contracting as often. Blood starts pooling in the lower legs, and circulation slows. That's why one of the best ways to restore circulation is simply to reactivate that pump. And the easiest way to do that brings us to the heart of today's video, the one-chair exercise that activates your body's second heart. I'm going to walk you through the one-chair exercise that activates your second heart. The exercise I'm about to show you is extremely simple. It's called the chair-supported calf raise. And it's one of the safest and most effective circulation exercises men over 50 can do. You don't need weights. You don't need a workout plan. You only need a sturdy chair. So now let me walk you through step-by-step how to perform this exercise correctly. Here's the step-by-step how to perform the chair calf raise. Stand behind a stable chair. Just a normal, ordinary, everyday chair that every home will have many of. Place both hands gently on the back of the chair for balance. Your feet should be about hip-width apart. Keep your posture upright. Relax your shoulders. Now slowly rise up onto the balls of your feet. Lift your heels off the ground. Hold that top position for about 1 or 2 seconds. You should feel the muscles in the back of your lower legs tightening. Then slowly lower your heels back down to the floor. That's 1 repetition. Now repeat the movement. Rise slowly. Pause briefly. Lower slowly. Aim for about 15 to 20 repetitions in 1 set. If possible, perform 2 or 3 sets throughout the day. That's it. That's the entire exercise. But inside your body, something important is happening, which leads to the next question many men ask. What exactly happens inside your body when you do this exercise? What happens inside your body when you do this? Every time you rise onto your toes, your calf muscles contract. And when they contract, they squeeze the veins inside the muscle. That squeezing pressure pushes blood upward toward your heart. When you lower your heels again, the veins refill with fresh blood. Then the next contraction pushes that blood upward again. So every repetition works like a mini circulation pump. This repeated pumping improves what doctors call venous return, the flow of blood traveling from the lower body back to the heart. And when this circulation improves, a number of health benefits begin to appear, which brings us to an important part of this discussion. Let me explain the health problems this simple exercise can help address. First, there's the issue of poor circulation. When blood pools in the lower legs, oxygen delivery to tissues decreases. Regular calf activation helps keep blood moving through the legs and back toward the heart. Second, there's swollen ankles and feet. Fluid buildup often occurs when circulation slows and gravity pulls fluid downward. Activating the calf pump helps move that fluid back into circulation. Third, there's cold feet. Many men over 50 complain that their feet feel cold even in warm rooms. Often this is simply a sign that blood flow to the extremities has slowed. Improving circulation helps warm the feet naturally. Fourth, this exercise can help reduce feelings of heavy or tired legs after sitting. And finally, stronger calf muscles contribute to better balance and stability, which is important for preventing falls as men age. But there's another area where circulation matters more than most men realize. And that brings us to the surprising link between circulation and sexual health. Most men are shocked by the surprising link to erectile health. Yes, better blood flow directly impacts on how strong, healthy, and long-lasting your erections are. Stronger, smoother overall blood flow will help men who suffer from erectile dysfunction. Let me expand on that. Erections are fundamentally a circulatory event. When a man becomes aroused, blood flows into specialized tissues in the penis. That blood flow creates the firmness associated with an erection. But if circulation throughout the lower body is sluggish, this process may become less efficient. Now, exercises like calf raises are not a cure for erectile dysfunction, but they do something very important. They support the overall vascular system responsible for delivering blood to the pelvic region. Healthy circulation in the lower body supports healthy circulation everywhere, which means exercises that strengthen circulation can indirectly support erectile health. But circulation in the pelvis also plays another role many men overlook. Quick pause. Before we continue, as we are talking about men's health and well-being, here's something worth knowing. If you've been feeling frustrated or even embarrassed about changes in bedroom performance, sensitivity, stamina, or desire, you're not alone. And it's not your fault. There's a 100% natural solution that's already helped thousands of men feel confident and energized again. No pills, no injections, no procedures, no surgery, no risky shortcuts. Just a simple, easy home remedy you can make at home, designed to support what researchers are now calling the manhood molecule, a key factor for arousal, blood flow, and lasting power. Find out more. There's a link in the description and in the pinned comment. Check it out. It could be the very thing you've been looking for. Okay. And that brings us to the prostate and pelvic circulation connection. The prostate gland sits deep within the pelvic region. Like every organ in your body, it depends on healthy blood flow. When men sit for long periods and move very little, circulation in the pelvis can become sluggish. Some researchers refer to this as pelvic congestion. Movement helps prevent this stagnation. Exercises that activate the lower body, especially those that stimulate circulation, help maintain healthier blood flow throughout the pelvic region. That includes the tissues surrounding the prostate. Again, this exercise isn't a treatment for prostate disease, but it contributes to the kind of vascular health that supports the entire pelvic area. So now the natural question becomes, how often should men over 50 perform this exercise? One of the best things about the chair calf raise is that it fits easily into daily life. You can do it almost anywhere, in the kitchen, in the living room, even while watching television. A simple routine could look like this. 20 repetitions in the morning, 20 in the afternoon, 20 in the evening. That's just 60 repetitions per day, and the total time required? Less than 3 minutes. But if you'd like to increase the benefits, there's a slightly more advanced version you can try. Which brings us to the advanced version of the exercise using the same chair. This is the advanced version of the chair exercise. Once the basic calf raise becomes easy, you can make it more effective by slowing the movement down. Rise onto your toes slowly. Hold the top position for 3 seconds. Then lower your heels over 3 seconds. This longer time under tension forces the calf muscles to work harder and strengthens the circulation pump even more. Eventually, some men progress to single-leg calf raises, but only if balance and strength allow. And of course, whenever you're starting a new exercise routine, safety is important, which leads to our final section. Safety tips every man over 50 should know. Always use a sturdy chair that won't slide. Move slowly and with control. Avoid bouncing movements. And stop if you feel sharp pain. If you have severe circulation disorders, balance issues, or nerve problems in your feet, it's always wise to speak with your doctor before starting any exercise routine. For most healthy men, however, this is one of the simplest and safest movements you can perform. And that brings us to the final takeaway. The bottom line every man should remember. Your body has a built-in circulation pump in your lower legs. A pump so powerful that some doctors call it your second heart. But like any pump, it only works when it's activated. The simple chair calf raise activates that pump. It helps move blood upward. It supports circulation. It reduces pooling in the legs. And it contributes to healthier vascular function throughout the body, including the pelvic region where circulation plays a role in both prostate health and sexual performance. And the best part is this. You can start today. No equipment, no gym, just a chair, and a couple of minutes. Because sometimes the most powerful improvements in health come from the simplest daily habits. Now, watch this video for more revealing content on men's health and well-being.